If you've been diagnosed with diminished ovarian reserve DOR, you might feel like your only hope is IVF or egg donation, but what if there is more to this story? In this episode, we're breaking down the key differences between the conventional and the functional medicine, functional nutrition approach with DOR. We're going to explore why ovarian reserve declines, and we are going to be giving you a plan to improve pregnancy success if you decide to go to IVF or if you're looking to get pregnant naturally. Excited for you to listen to this episode. Let's go. Welcome back. I'm Sarah Clark, founder of Fertile. For over a decade, my team and I have helped hundreds of couples improve their chances of pregnancy success, whether naturally or through IVF. We specialize in supporting those with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, and recurrent pregnancy loss through functional testing and personalized fertility strategies. Today, we are digging into the conventional medicine versus functional medicine, functional nutrition approach for diminished ovarian reserve. This episode is for you as if you've been diagnosed with DOR and you're looking for more than just the conventional fertility treatments like IVF or egg donation. You're wondering about the underlying reasons for the diminished ovarian reserve, including thyroid, inflammation, nutritional deficiencies, and how they impact egg quality. You're considering a holistic approach and you want to understand how functional medicine, functional nutrition can support your fertility journey by addressing lifestyle factors and underlying balances. And you're curious about the key differences between the conventional treatments like IVF and hormone therapies and the natural functional approach, focusing on diet and supplements and stress management. And you're exploring ways to optimize your ovarian reserve and egg quality naturally before resorting to aggressive treatments. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who is on the fertility journey, please share this podcast with them. Okay, so we're going to get into it right now. The conventional approach versus the functional nutrition, functional medicine approach for diminished ovarian reserve. So typically you want to make sure you do some of these conventional testing. It's not about omitting some of these things, but a lot of times people are just staying in a conventional medicine approach and not even realizing there's things you can do with your diet and lifestyle. So that's what we're going to be talking about today. So the testing, looking at your AMH levels, I've talked a lot about AMH levels. So we definitely don't hang our hat on it. This is not the only thing we're focusing on. Typically in conventional medicine, if you've got diminished ovarian reserve, they're considering it diminished ovarian reserve if it's anywhere between 1 to 0.5 ng per ml. Anything lower, then they start thinking that potentially could be premature ovarian insufficiency, although this is not diagnosing or anything like that, but those are the ranges typically looking at. And then FSH, so early onset could be anywhere for diminished ovarian reserve, anywhere from 10 to 15, or an advanced stage, 15 to 25. And typically you're still having your cycle, but it could be a little bit irregular. And then they're going to be doing an ultrasound, looking at the antral follicles and checking the overall health of the ovaries. So you do want to check things from a structural standpoint. And a lot of times people we work with, they're doing the diet and lifestyle, understanding their biomarkers and looking at their functional lab testing, and then going in and checking their follicle count and potentially deciding when they want to do an IVF. So we're not opposed to IVF. It's not our position here. If the majority of us can get pregnant naturally, working on our health and addressing all the underlying issues of why it might not be working. And then if we do need to have assistance, you'd set your body up in the absolute best shape. And then sometimes, this is usually more for premature ovarian insufficiency, but sometimes for diminished ovarian reserve, they might want to do some genetic testing, so Turner syndrome or Fragile X. Sometimes they're saying that could contribute to diminished ovarian reserve, so diminished ovarian reserve and then premature ovarian insufficiency. And then so some conventional treatments, there's a lot of information about this, so you've got to really be your own advocate and do your own research on this. And things are changing as treatments start to change and more people go through IVF. Fortunately it's there. It was designed for people that have blocked fallopian tubes, and now people with unexplained infertility and every other fertility condition seem to think this is the only option. As we're saying, it's important to really work on your health, but they may give you a stimulation protocol for IVF. And so typically, diminished ovarian reserve, you're given higher doses of medication to increase egg production, but sometimes that can be too much because it can overstimulate the ovaries. There's other studies saying it's better to give a mini or a low stimulation, so gentle stims using lower doses of medication, maybe combined with letrozole or Clomid to enhance follicle recruitment. And they want to reduce the risk of overstimulation, which can support better egg quality. You can pull some studies there and look at that from what's better. Is it higher dose stimulation or for diminished ovarian reserve? More studies coming out now about that it's better to do mini or low stimulation. Again, that's something you've got to speak to your REI about. And then maybe they just say that the diminished ovarian reserve is too severe and the only option for you is donor eggs. And so they're going to tell you to do donor eggs, and maybe they'll prescribe some birth control pills. So we see many times people that they've got a regular cycle, so the doctors are going to prescribe birth control pills to really regulate the hormones before IVF or other fertility treatments. Thing is, with birth control, we're seeing people on long-term hormonal birth control that can then predispose you to gut infections and food sensitivities, and we're falsely regulating the cycle. Why is your cycle irregular to begin with? Obviously, sometimes it can be needed if you're going to IVF, but just bear in mind, we're looking at the underlying reason why it's off, but that can be recommended for you. And then standard of care potentially for diminished ovarian reserve might be DHEA. We always want to test it beforehand. Typically, it may not be tested. It could just be recommended. So there is some side effects from that. Greasy hair, greasy skin, some mood swings. Maybe yours is low and it's a good recommendation, or maybe it's not. We see it sometimes sky high. And maybe you're recommended some CoQ10. So there's a lot of good studies about that. Ubiquinol, CoQ10 can really be helpful for ovarian function, although that's not always the standard. But those are some conventional recommendations. You definitely do want to get the testing, looking at your AMH, look at your FSH, look if there's any structural issues or blockages, or maybe you have polyps or fibroids, and then you can research to see which IVF protocols, there's different clinics to be able to advocate for yourself there and to see what's going to make sense. But we want to always combine this with looking at your health. And it may feel like the fast track is that conventional side of things, but we've got to look at some of this other stuff we're going to talk about here first. So this is the functional versus the conventional approach. So the functional is we're going to look underlying factors might be contributing to the ovarian reserve decline. And we see AMH levels go up, follicle counts improve when we start to work on our health. And thyroid health, this is our whole thesis of here. Is it actually early menopause? Because that's what they're telling you. A diminished ovarian reserve is typically if you're over the age of 35, and premature ovarian insufficiency, typically under 40, but it could be some people are being told they have POI in their 40s. So we just want to be careful of the diagnoses. We're not here to diagnose anyone. So you've got to go to your doctor and receive a diagnosis. But we don't hang our hat on the AMH, the FSH, the follicle count, the POI, the DOR, these labels. We need to know what they are so we can know what we're working with, but we're looking at the whole body and being able to address what's caused these things. So thyroid health, either looking for thyroid dysfunction such as hypothyroidism, maybe you've been given thyroid medication such as Synthroid or levothyroxine because your TSH is high and your REI has told you to take that. But why is your thyroid off to begin with? Is there the adrenals, your gut infections, food sensitivities, environmental toxins? All of that can impact the thyroid. I've talked a lot about thyroid health on the podcast. There's hyperthyroidism too. So we typically see more hypo and Hashimoto's, maybe some of those antibodies that you have. The thyroid antibodies, those are elevated, and then you're going for IVFs and wondering why that's not working. So we're looking at that. The thyroid plays a critical role in egg quality. So we've got to check the health of the thyroid. This is some low-hanging fruit that has been missed. And if we haven't checked the health of our thyroid, then we go off and wonder why we're being told we have poor egg quality or the embryos aren't making it. That could be a reason. We do see it across the board, not every single person, but a very high percentage of people with diminished ovarian reserve have something going on with the thyroid. The adrenals, so that chronic levels, those high levels of chronic stress can then elevate the cortisol and then contribute to those hormone imbalances and then accelerate the ovarian aging. So like we said, the adrenals, the thyroid, the AMH and the FSH and the follicle count, we need to nourish the adrenals, get the body back online. If you've been burning the candle at both ends, working a job more than 50 hours on the fertility journey, maybe having issues with relationships, family, trauma, moving, financial issues, whatever it is, stress, life, that can then impact your hormone levels. And that may be why the period's not here. And pushing ahead to an IVF, even if it's covered by insurance, the emotional impact of doing that, we haven't set up a strong foundation. And most people don't go to IVF having not done anything. You've already probably made some diet changes. You probably worked on your meditation. You probably taken some yoga, but it's generalized recommendations. We got to do this in a very personalized manner. So looking at the healthy adrenals, inflammation. If your body's inflamed, that's why people with diminished ovarian reserve or POI, they're recommended to go off and do PRP, so platelet-rich plasma ovarian stimulation, and you're putting inflamed cells back into the ovaries and wondering why that doesn't work. You really got to work on reducing inflammations from food sensitivities, from gut infections, the toxins, and maybe you've got an autoimmune condition. So you've got celiac or lupus, or you've got MS, or you have Hashimoto's. We see a lot of people with autoimmune issues, and then they're rushing down the IVF road and wondering why it's not. That is the clue. We cannot, if you have got an autoimmune condition, you have got to work on your health first. It is just throwing money in the away and setting yourself up for heartache. We've got to be able to reverse this and really work on your health. And so reducing inflammation, if you've got inflammation in the body, that can impact your egg quality and might be the reason why, like we said, some of the retrievals aren't working, they're being canceled, or the transfer is not implanting. So you've really got to work on reducing inflammation. Nutritional deficiencies. So we really look at nutritional deficiencies. A lot of times we see people are low in vitamin D and magnesium and zinc and antioxidants. Those are all critical for reproductive health. And if you are low across the board, we do hair tissue mineral analysis on that and really can check nutritional deficiencies, also looking at your biomarkers, all of your blood work, and see where do we need to boost things up. And so if you're low, that could be a reason that the reproductive health has been deprioritized. So we got to dig deeper. And then toxins. I think many of us know about throwing out the plastics and making sure you have organic. You don't want to be having glyphosate, all the herbicides and pesticides that you're exposed to in our food here. All that can impact ovarian health, diminished ovarian reserve, also the health of the sperm as well. And so we really want to be able to reduce these endocrine disruptors and all the toxic personal care products, the cleaning products, anything with a fragrance, with a candle that has a fragrance, that should be thrown in the garbage. If you got candles or Glade plugins or any of that stuff, just don't use that. The rest of the stuff, you want to gradually replace it. It's not about throwing all your cosmetics in the garbage. Each one expires, you replace it with a non-toxic option. There are tons of options. It took me years to do that because I have sensitive skin, like a lot of us do, and trying to find brands that work for us. And so being able to do that in a targeted manner, that can just reduce our environmental toxins, and that can impact the health of your ovarian health. And then really digging into this in a personalized approach, right? So you can throw the spaghetti at the wall and just say, hey, it's not working. And you've already made some diet changes. You took out the plastics. You reduced your environmental toxic load here. But we need to look at this in a personalized approach. So doing the anti-inflammatory diets, essentially doing the elimination diet, which I've talked a lot about. If you look up the podcast episode, AMH diet, which is the elimination diet, taking out the top allergens for 10 days, systematically reintroducing them, and then really taking that load off the body, reducing inflammation, which supports ovarian health. Considering some supplements, so we like a methylfolate prenatal, do a CoQ10, omega-3. So CoQ10 can help with mitochondrial health and energy production in the eggs. Omega to reduce inflammation. All of us should be taking omega. Vitamin D, just done a podcast episode on that, how that's so important for overall ovarian health. We see a lot of people with low AMH and low vitamin D levels, so that can impact your immune regulation. And then consider NAC, so an antioxidant support egg quality. So the diet and the supplement piece, a lot of people just lean into the supplements. And the supplements can be fine, but I see a lot of people taking way too many, spending all this money. You can just have expensive pee. So we need to be very careful on overloading with supplements and then not actually addressing the diet. I see so many people, I'm taking all these supplements. Have you taken out gluten? No, I haven't. I don't want to. Okay. Like you've got to suck it up. Take out gluten and do the elimination diet for 10 days, systematically reintroduce over 30. Keep out dairy and gluten for 60 to 90 days, tweak it with food sensitivity testing. And then the next one we're going to be talking about is look at your gut health. Maybe your gut microbiome is an absolute mess. You've got bacterial infections, parasites. You're not absorbing any of your nutrients because you have H. pylori and it lowers your stomach acid. Maybe you've got that GERD or acid reflux. Maybe you don't. You can still have it. Maybe we see a lot of people swapping infections back and forth. Maybe that's the issue. And so we need to be able to add in some probiotics, reduce inflammation, eliminate those food triggers of every time I have dairy, it gives me digestive issues, or every time I have this food, I just feel horrible. And then you keep eating it. No, the body's giving you a clear signal. And then many times the body doesn't give us that signal until maybe 2 or 3 days later. We don't really know. So that's why the elimination diet is the gold standard. But you've got to reduce gut inflammation, and that can interfere with nutrient absorption. And maybe that's why the nutrients are all low, and that's why the egg quality is poor. Hormone balance, so balancing estrogen, progesterone, cortisol, so the lifestyle modifications that we talked about, all of that piece doing. You can add in journaling, meditation. We use heart math, which has been used in hospital settings, corporations, schools for over 25 years, 400 peer-reviewed studies. Really helps you get into that parasympathetic, because maybe the body is in fight or flight and we got to reset the nervous system because you've just had years of chronic stress, and now the body, as we force it to procreate, it's just not ready, and then the hormones are out of balance. And so sometimes we need to support the adrenals with ashwagandha, or there's cortisol manager, or we can consider maca. But we just need to be careful about throwing those adaptogenic herbs at it. That can be part of it, but doing this in a very targeted manner. And then specific nutrients. A lot of times we see people that are poor methylators, and so you need to have additional B vitamins or zinc and specific nutrients that can help with balancing hormones. You want to make sure those are all methylfolate. And then stress management. So like we said, the meditation, the yoga, whatever is good for you, walking outside, all of this to reduce cortisol levels, and that can support your ovarian health. Mindfulness, just pick something, whatever feels right for you, but select it. It's not about doom scrolling your phone or watching TV that doesn't make you happy. You can watch some reality TV, but if you're finding you're watching it for hours and hours, is that really the best use of your time? Before bed, reading a fiction book, not nonfiction. So you're up late trying to figure out a problem. You want to be able to get yourself into a nice bedtime routine with maybe doing some Epsom salt bath, or a nice herbal tea, a chamomile tea, a nice foot soak, an Epsom foot soak, put some magnesium spray on your feet, use some blue light blocking glasses, so that campfire effect. And then you just naturally feel sleepy. You go to bed. Watching TV before bed, I did it yesterday. I was watching The Bachelor, watching it till 11 o'clock at night. Usually I read a book before bed, and then I don't know why I was fired up about the episode. It wasn't even that exciting, but I've always watched The Bachelor. It's a bad little habit, but it's like my guilty pleasure. I enjoy it. But I normally don't do it right before bed, and I did, and then I had a hard time falling asleep, and I'm tired this morning. And sometimes we do that on a cycle, right? We just keep doing it over and over again. So being able to get that bedtime routine, if you're going to bed at 1, we don't want you to then start going to bed at 10. That's too much. You need to be able to gradually reduce that 15 minutes every week, and then get yourself into a better bedtime. But pick something for stress management, and that's key. And then those lifestyle modifications. So getting the proper sleep we just talked about, movement, not too much, not too little. Now is not the time for CrossFit and doing boot camps and doing a triathlon or training for a marathon. Just don't do that. And if you're like, oh, that's how I cope with stress, we want you to really examine that and be able to stop here for a period of time. A lot of times we'll ask people, how do you feel after you exercise? And if you exercise all the time, you're really, I feel great. But is your body struggling? Is it just too much? So doing bar or Pilates or a brisk walking, do some weights 3 times a week. It's important to do something, but we don't want to overdo it. And so if that's you and you're like, there's no way I could stop, that might be it. That might be too much for you. So have an open mind. If you don't have an open mind and you won't change it, there's nothing we can do. But most people we work with are coachable and have an open mind, and they're like, what changes can I make? So we help you get out of your own way. And then all of this can then help improve egg quality. So the key differences between a conventional approach is, obviously, it's the conventional approach, you don't want to skip it. You want to diagnose what's the situation here you're dealing with. But they're going to recommend IVF or egg donation. With a functional medicine and functional nutrition approach, it's looking at the underlying reason why. Is it the thyroid? Is it inflammation? Do you have the wrong diet? And then testing, we do want to get that AMH and the FSH, and the antral follicle count, the ultrasound, and we do want to know where all your levels are, but we don't hang our hat on it and think there's nothing else we can do. And from a functional standpoint, we're going to look at the thyroid, the full panel, including antibodies. We're going to do gut testing. We're going to look at your hormone levels. We're going to use a fertility tracker on a monthly basis using urine. We like the Anita or Mira fertility tracker. We're going to see your hormone levels on a monthly basis and see what's happening there. It can combine with blood work, combined with functional testing such as food, stool, genetics, different from that karyotyping testing genetics you're doing at the fertility clinic. And then we're going to be looking at your biomarkers, your blood work, developing a personalized protocol and addressing all those things that are imbalanced. So fertility treatments, they're going to either do an aggressive IVF or maybe a mini IVF or tell you it's donor eggs or give you DHEA. On the functional medicine side of things, we're looking at the diet that's right for you. So that elimination diet, we're taking some supplements, not a boatload of supplements. We're taking some targeted supplements. We're making targeted lifestyle changes. The elephant in the room is the stress that we're all under, the pressure that we put on ourselves, the impatience, the panic, the worry, the catastrophizing, the ruminating, all of that piece. We have got to reset our nervous system and get the body back online. Because if the majority of us can get pregnant naturally, what's been missed with your health? And you'll either work on it now, or it's important to have a healthy pregnancy, your postpartum period, your nursing, the health of your child. This is you affecting future generations. And it starts with putting yourself first, nourishing yourself so then you can take care of your child and your family. Hormonal support, maybe they're going to give you those different IVF stimulation protocols. Maybe they'll give you that DHEA. Maybe they'll tell you to take up CoQ10. We're looking at targeted supplementation with the vitamin D, obviously omegas and CoQ10 and some adaptogens to help with your adrenals, gut infections. If you got a parasite or a bacterial infection, we got to address that. And we can't just do a random parasite cleanse. Maybe that's just too harsh. Some of these things are people doing carnivore diets, all these keto, all these things that are just not right for cycling women. And so these things are more geared for guys. Doing cold plunges, for staying in there too long, it can just be too harsh. And so we need to be very mindful of these strategies that are just, again, not necessarily right for someone on the fertility journey. And so underlying conditions from a conventional approach are not going to investigate why you're dealing with diminished ovarian reserve, why your period is irregular, why the AMH is so low. It's just, here it is. And this is the next step. They're going to tell you either a surgery is necessary for you for polyp or fibroid or cyst, something you have going on, or they're going to tell you medication, Clomid, letrozole. They're going to tell you to do an IVF protocol. Whereas the functional medicine and functional nutrition, we're looking underneath. Why do you have this inflammation? From food sensitivities, environmental toxins, gut health, thyroid imbalances, blood sugar. We haven't even talked about that one. Blood sugar imbalances. Where is your blood sugar on a little roller coaster? I was traveling last week and I brought some meat sticks and I brought some protein bars with me, but I did not have enough protein. I feel way better when I have more protein and fats, and I need some vegetables. And sometimes people do well on this carnivore. Again, it's not where we recommend. It can lead to nutrient deficiencies. So it is not something long-term. And we don't recommend it for anyone on the fertility journey. I know there's some clinics that say to do it, but that's just not where we go. And so if you need more protein and fat than you think. And so cooking with tallow, with lard, with coconut oil, with olive oil, not cooking with olive oil, but putting that on your foods can be really helpful. And for me, when I didn't get enough protein, I just felt off. And sometimes we feel off for years and we don't know it until we start feeling great. Most people I talk to, hey, how's your health? Health is pretty good. How's your stress? Off the chart. And obviously, there's many people I talk to, their health, and they have a laundry list of things going on, and then they're trying to force the body. And then the long-term strategy is for conventional medicine. We keep doing an IVF. We change the protocol. We add more medication. We do a low dose. We do a high dose. We keep doing the same thing over and over again, and we wonder why it hasn't worked. We're not opposed to IVF. And so you've got to speak to a specialist, speak to someone that you feel confident with, talk to them about some of the studies, and have a conversation. But without working on the functional medicine, functional nutrition approach, we have missed something. So we got to restore your hormone imbalance. That will improve your ovarian function over time. So which one is best? So conventional medicine, if you want to immediately support your fertility, especially if you're seeing severe diminished ovarian reserve or advanced maternal age, we need to be very mindful of this piece. And so a lot of the times if you go in and they think they can help you with an IVF or a PRP or any kind of treatment, they're going to tell you that you've got to rush. And then each month things are dwindling. Obviously, if you're in the mid 40s or late 40s, we need to be mindful of this, right? We're not going to be just, again, throwing spaghetti at the wall. But we want to make sure when we do the retrieval, when we do the transfer, this is actually going to work. So we can do this in conjunction, making the diet changes. You've got to give us 30 days for the medication to not be in your body to then do the testing, to do the stool testing, look at your blood work. And then we can start the testing, and then we can start making the changes. It takes about 4 to 6 weeks to get our test results back. So in the middle of there, you can still be tracking your cycle, working with your clinic, and continuing on with that. But be careful of you've been told it's DOR, it's advanced maternal age, you have to rush, because I see a lot of people that hasn't worked, and it can lead to a lot of heartbreak. Functional medicine, functional nutrition, really, if you're listening to this podcast, I'm assuming that you're interested in this stuff and you're ready to dig deeper, right? And so this is targeting underlying imbalances and really improving your ovarian health, improving your health, the health of your pregnancy, your postpartum period, the health of your child. There's no negative side effects for you working on your health. And so a lot of people will integrate both approaches. So we do it depends on your timeline. Sometimes people are like, look, I can do this for 6 months. I want to get pregnant naturally. 6 months to a year. Great. Because our average success is 12 to 18 months. And if that's you, great. Or if you're like, you know what, I feel this timeline, I feel a little crunched, we can do things in tandem. You got to give us a period of time there where you don't have the medication in your body, so we can make some of these changes. And if we find you got a gut infection, a parasite, you need to be able to address that, not just keep going. If you're investing in the testing and working on your health, you got to give time to do the protocol. And then also working on the mindset piece, because we feel very rushed. Next thing we know at the fertility clinic, and we haven't worked on our mindset, and our nervous system is out of balance. Maybe you're a perfectionist. Maybe you're someone who's hyper vigilant. Maybe you're controlling. I was talking to my son the other day, Mom, Dad is quiet. He doesn't say much, and you just control. I'm like, okay, I've been working on my controlling tendencies. Especially my son likes to call me out on crap, which is good. I call him out on crap too. It's being able to let go. Especially in the teen years when they're doing drugs and it's a complete shit show. Eventually, we stay patient, we maintain the relationship. Eventually, they come out of it. So my kids are 23 and 20. So it is being able to work on yourself, and then you can help people around you, not just pointing out everybody else's flaws, and then you're not able to self-reflect and work on yourself. If everyone else is an asshole, I wonder who else is in the room. It's you. So we need to be able to work on, if everyone you meet is driving you crazy, you might be part of the equation. But if you're a perfectionist, if you're someone who likes to control, if you're impatient, if you feel frustrated, all this energy, we need to be able to drop into our heart space. And if you're like, that feels foreign to me, we do it a little bit each day, and that heart math can really help. So I'll link an episode into that. But at the bottom line, we got to reset the nervous system. If it's years of stress, that can impact the health of your egg quality and your ovarian reserve, as we feel so constricted here. It's really important to give yourself some grace on this. If you're ready to get pregnant this year, just go ahead and send an email to hello@fabfertile.ca, subject line fertile, and we will come up with a plan to improve pregnancy success. If you're going to IVF, if you want to get pregnant naturally, we support people with diminished ovarian reserve, improve pregnancy success. So hopefully this was helpful for you, and take care.